Hello everybody, this is Dr. Mark and I will be covering a very important topic today, dental cleanings. I will be covering the 5 most common questions I get regarding this issue. The first one being, why do we need to get dental cleanings if we brush and floss every day? Well, let me divert a little bit. Why do we brush and floss at all? We brush and floss to take care of something called dental plaque. Dental plaque is a mixture of bacteria, food particles, and salivary proteins, and it is totally normal. However, the problems occur when we don't brush it off in time. It hardens into something called tartar. Tartar is like superglue. It sticks to our teeth and it is pretty much impossible to take care of with a regular toothbrush or floss. In fact, we need to get the aid of a dental professional to go ahead and scrape it off for us. So, what happens if we forego the cleanings altogether? This tartar just builds up, continues growing, and because it is a breeding ground for bacteria, it can cause a host of issues. Infections, cavities, bad breath, and gum disease. Gum disease is especially critical because at the later stages of it, we get bone loss under our gums and wiggly teeth and eventually tooth loss. In fact, this is the #1 cause of dentures in the United States. So, knowing this information, how often do we need to get cleanings to avoid all of these symptoms? Well, it really depends. Most often, about 6 months, but some people may need to get dental cleanings a little bit earlier. Some people build tartar quicker. They're on medication that causes tartar to build up quicker. Or they even just have mobility complications such as arthritis, which need a little bit of help at the dental clinic to keep their mouth clean. So we often do cleanings from about 3 months out to 6 months out, depending on your needs to keep your mouth healthy. The next question is, do dental cleanings hurt? And no, dental cleanings should not hurt whatsoever. There may be a bit of discomfort with, sensitive gums, irritated gums. You will feel a bit of scratching or scraping along the teeth, a little bit of pressure to take off the buildup, but there should be no pain. In fact, we have an aesthetic gel that we can put on your gums to make the process a lot smoother and a lot comfortable. In fact, many of our patients are surprised about how comfortable dental cleanings can be. Some people ask, do we need to get dental cleanings if we're not experiencing any pain? And unfortunately, the answer is yes, you do. A lot of the diseases in the dental world are not pain related, such as cavities. Cavities can occur without pain. Infections can occur without pain, and periodontitis can occur without pain. The best thing you could do for yourself is come in, get a cleaning, and get a checkup, and catch all of these issues early on so we don't have to do any complex interventions later on. It'll save a lot of trouble for you, a lot of pain, and a lot of headache. So again, this is Dr. Mark on cleanings. Thank you.